Welcome to ncmassageschool.com, where today we're going to learn neuromuscular therapy to the trapezius. The trapezius is one of the most common muscles to develop tension on a day-to-day basis in the body, followed up second by levator scapula, which is just adjacent to it, slightly superior. The trapezius is a diamond-shaped muscle running from the external occipital protuberance down all the way to the lateral third of the clavicle, to the acromion, along the spine of the scapula, and then attaching all along the spinous processes of C7 down to T12. The most common area for the muscle to develop tension is in the upper fibers. The upper fibers bilaterally extend the head. If you'll just do that a little, Lori. Up off the table. There you go. And you can see this is the first head of trapezius. Thank you, relax. And you can palpate that through pincer compression with your thumbs on the spinous process, your fingers off to the side, and notice right there is the muscle, and then I'll roll off onto skin. Muscle, skin. Just see the twitch response. One more time. Muscle. Now we rolled off of it. So to effectively treat this muscle to alleviate tension from maybe riding your bicycle, like Lance Armstrong with his head extended, you would compress this muscle 5 seconds to 20 seconds. Standing cross-body for your own good body mechanics so that your wrists are nice and straight. Client is taking a nice deep breath, and with each exhalation, the muscle will soften. After pincer compression, some nice linear fiber friction to further coax the muscle fibers apart. And one more position, a little further down. There's the muscle, and we're off of it. So pick up the muscle. And if you're unable to do this on your partner, then just pick up both sides bilaterally until they soften. This is the most effective treatment to the muscle. You can manipulate it between your thumb and fingers and feel for isolated taut bands. Compression 5 to 12 seconds, and then linear fiber friction. And for the sake of the camera, I'm still going to treat cross-body, although ideally you're going to be standing same side for the second head of trapezius. This is the area that is overloaded from sustained elevation, such as talking on the phone, or sustained compression, such as a tight bra strap, pocketbook, book bag, or luggage. Could also be overloaded by a side-to-side motor vehicle accident, whiplash injury, such as being hit at the driver's side or passenger side door. Again, we're doing pincer compression and linear fiber friction to the muscle, all the way out to the distal fibers, which often harbor latent trigger points. Trigger point commonly refers pain in an inverted question mark along the base of the neck to the posterior lateral ear and around to the temple. Again, we're isolating just the second head of trapezius. No levator scapula, no other muscles. And friction. Once this softens up, the muscle actually curls around to attach to the lateral third of the clavicle. So we want to come back and kind of uncurl the fibers. They kind of curl up like this. So we want to go in, instead of just compressing, we want to go in and uncurl those fibers and get to the distal fibers and work them and then release them. Kind of like peeling an orange. Again, the most common muscle to develop trigger points and tension on a day-to-day basis, the upper fibers of trapezius. And linear fiber friction. Okay, that's the second head. These are the two areas that commonly contribute to a lot of tension in the shoulders, neck, and along to the temple. The other fibers are the third head of trapezius. Often they're not involved in tension or day-to-day tension. The middle fibers retract the scapula. Often they are painful, but they're being overstretched from hypertonic pectoralis major. So although painful, symptomatic only and not a primary culprit. Third head of trap. Fourth head of trap also often overstretched and overloaded due to tight pectoral muscles or sustained elevation. So again, symptomatic pain, but not a primary culprit. We can go in here as it comes off the medial board of the scapula, and we can pick that muscle up as well. This is fourth head of trap, and right there, it's a little higher than I drew. Right there's fourth head of trap, and now just skin. Again, you can see the twitch response of the muscle, fourth head of trapezius, and now I'm just have skin. So again, you can do pincer compression to the muscle. You can see it. And no, this does not hurt, if you're wondering. This is just snapping palpation, and the body's listening to twitch response. And it's a way for you to identify the muscle and therefore better be able to treat it. Again, pincer compression and linear fiber friction. You can come in and actually pick up the muscle in some individuals with both hands and bow it. I'm going very quick for video purposes. You want to be patient with the body and allow it to respond. And that's the treatment of all four heads of trapezius, first, second, third, and fourth, with the second and first being the most common culprits of day-to-day tension. This is just treatment to the muscle belly, where the spindle cells will respond. We also want to work the attachment areas along the spine with some nice compression, gently, to stimulate Golgi tendon, inhibitory response. And at the attachment along the superior nuchal line and the external occipital protuberance, just doing some nice linear friction to the attachment sites to stimulate muscle relaxation. If you're not sure where those muscles are, you can again have your partner extend their head, first head, thank you, elevate your shoulders, second head, okay, and do a little Superman pose with just that on. And oftentimes you can see the fourth head right here. Thank you. And that is a quick overview of neuromuscular therapy trigger point treatment to the most common culprit of day-to-day tension, upper fibers of trapezius.